Thanks for joining us. This is great. What a good turnout. First time I've met with the foundation group. Maybe some of you it's the first time also. We are, I'm going to try and go through this fairly quickly because of the time. Have maybe, 15 minutes? Okay, so I'm going to show you a lot, but you look like a very smart group, and so I'm going to go quickly because I think you'll grasp these concepts pretty easily. And what we really want to talk about today is why conservation and why health and how our future and the well-being of the environment are also closely linked. And I think we can use health as a bridge. And I'm just going to give you some examples of how we make that work around the world. Kelly had mentioned that we're based at the Bronx Zoo, but we manage the zoos around the New York area. And what we've noticed, we take care of tens of thousands of animals, and we have contact with millions of people every year. And we use that opportunity, obviously, to teach people about conservation and about the value of wild places and wild animals. But if you also wanted to design a surveillance system, you couldn't design it any better than this. So you have thousands of animals of different species, and animals are susceptible to many of the diseases we are, and livestock are, and you ring them around a large urban area, and you can start picking up on anything that might come in. And we've been doing this for a very long time. So we have a long history, about a 100-year history, actually, of practicing medicine with animals. So this is way back, Dr. Reed Blair and his spats at the animal hospital. And we take care of animals all around the world. This is a modern-day image, Dr. Paul Cowley taking care of a flamingo. So we work with hundreds of species. We really have expertise. And when David Barron earlier talked about exporting some of the good things of America around the world, our kinds of expertise we have in this country working with wildlife and wild animals is something that we've taken around the world to share with other countries to help them protect wildlife and make the world a better place. When West Nile virus came to the United States in '99, it was picked up at the Bronx Zoo first by our pathologist, Dr. Tracy McNamara at the time, and picked up on this. Once again, this kind of early warning system, because animals at the zoo were susceptible to this disease and they hadn't been exposed to it before. So that's the brain of a bird and the heart, and it has hemorrhages from a new disease entering the United States. So Kelly kind of referred to how is this all linked, and I'll try and get that and sum that up in the end. But when we talk about human infections and animal infections, they're often the same thing. Our programs extend around the world, our global health programs. So what we do in New York, we do in North America, and we do in South America and Africa and Europe. And we focus in developing countries. So we have health projects and health programs going on just today, really all over the world. And this is how we've really entered our, interface now with these issues of emerging diseases, because most of these emerging diseases are developing in the tropics, in poor countries in the developing world. So and that's where we work mostly. We have staff, health staff, permanently placed in, mostly foreign nationals. Most of our health staff work overseas full-time and are local people that we've trained over the years. So if you go down to the coast of Patagonia and you see sea lions, and there's a problem with the health care of sea lions down there, chances are you'll meet one of our staff members taking a little swab to find out why they have a runny nose. So we do this at the individual animal level, but more importantly at the population level. So for the government of Argentina, we've trained Argentinians and Chileans and Peruvians how to monitor the health of populations, because they're their animals and they need to learn how to care for them and know what's going on. Elephants, we do a tremendous amount of work with elephants all over the world. This is a few years ago just south of Timbuktu, helping the Mali government really work well with elephants and learn about the elephants and migrations in Mali. Last week, we just finished a training program in Uganda, northern Uganda, right on the border. Oops, let me skip. Oh, I'm sorry. Up in northern Uganda on the border with southern Sudan. And we work in both countries, and the elephants don't realize there's a political border there. So the elephants move around. So we've been working with the Uganda wildlife authorities. The gentleman in the center with the radio collar is the head veterinarian for the Ugandan wildlife Authority, which is the federal government there. And he's being trained by Dr. Michael Koch, who's a Zimbabwean who's on our staff, and he's an expert in elephant immobilization. So he went up to Uganda to start training local people on how to work with elephants safely. In Iran, just 2 weeks ago, one of our veterinarians has finished up a project in Iran studying the cheetahs in Iran. And this little kid actually came out of a confiscation, this little cub, that the wildlife authorities had caught a poacher, the mother had been killed, and they had this cub. So we can actually get involved and train them how to care for this animal. It'll probably end up in a zoo in Tehran, but we actually can advise them based on our skill sets to how to take care of animals well. And this little guy can become an ambassador for other cheetahs that are still in the wild. Back down in Argentina, we have a whale monitoring and stranding network that covers about 2,000 miles of the coastline, like we would do in North America, but we've trained Argentinians to do this themselves. So it's all self-run. We help out a little financially, but they're really running their own program. We taught them how to monitor the health of their marine mammals, how to deal with strandings, how to deal with diagnoses, pick up on interesting things like a red tide or harmful algal bloom, and have our Argentine staff working with the government staff working together. Up a little further north in Bolivia, we've really been working with local people, indigenous people. It's really wherever we work, of course, is we're non-political or apolitical, so it always pays off in the long term. So we've been using that approach for about 100 years. Right now in Bolivia, it's been very interesting because the local people, indigenous people of Bolivia, have legal authority over parks and protected areas, and we've been working with them for dozens or decades, actually. So whoever's in political power is really independent right now, of course, with President Morales, who came from an indigenous background. There's more pro, but while they're kicking out other groups that had traditional linkages with more political connections with the United States, we're still welcome to work there because we work directly with indigenous people. Why are we working with pigs and chickens? Because those are the animals that can bring diseases to wildlife. So if you look at North America, wildlife diseases in North America are really European livestock diseases that we brought over from Europe. So the brucellosis problem in Yellowstone was a European cattle disease. Avian influenza is a poultry disease. Rabies, the plague was brought over from Asia, actually. So most of the diseases we think about in wildlife in North America were brought here by people with their domestic animals. We're trying to prevent that in these remote places around the world. There's no reason for Bolivian national parks to get contaminated with livestock diseases. And the best way to do that is to work with local people to make their livestock healthy. And Sharing Plow is doing a similar thing in the Serengeti. We're vaccinating domestic dogs to protect people from rabies, but also protects wildlife from rabies. And in Bolivia, we've been working with local folks to try and find out what their issues and problems are. So they know that chickens have diseases. They don't know they're caused by bacteria and viruses and parasites, but they have local names. So we do community outreach, have workshops. They start doing little drawings, and they say, oh, we find these little worms in the intestines, and we call them this. And then our staff go, oh, that's a nematode, and you can treat them with this drug or this drug, and you can have healthier chickens. So we're doing a lot, actually, with Bayer, Sharing Plow products, Intervet products. We do little pharmacology courses for local people, and we have little cartoon books if people are illiterate, and teach them how to care for their livestock. We're doing it to protect the wildlife, but the local people love it, so they're very engaged. Now conservation has a good value and meaning to them. So we're working around parks and protected areas, and local people are getting engaged, because before they thought, we just want to set aside that land because we thought it was important and not let them use it. So instead, we're helping them benefit from these programs. So we work with them. This is a training workshop. Helping them with their cattle, we're teaching them how to do parasite exams, how to do the treatments like I mentioned. So it's a very integrated program around parks and protected areas. The Bolivia team, our traditional conservation team, says that the local people have been more excited about our conservation program since we've started this health work than they ever have been in the past, because now it really connects them with their food security, their livelihoods, and their own health.